Hi, welcome to WGSN-DB Going Solo. This is a senior citizens forum presented by Benefits for You Too Insurance Services. I'm Janice Wood, your host, and at Benefits for You Too Insurance Services, their expertise is in health insurance plans, Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans. But today we're going to be talking with Heather Reid, who's been on my show before.
Thank you for having me again.
Yeah, I'm really excited to have you back today. And we're going to be talking about what do you do if you need to choose a new primary care doctor. But first, just a reminder about Heather Reid. She's with a medical group called Welcome Health, where they've taken an old-fashioned idea, they've modernized it, and they like to work with seniors 65 and above, okay?
In the safety of your own home.
In the safety of their own home. So that means they would send the primary care doctor out to you.
So instead of the old school mentality of a briefcase, our doctors are coming with backpacks. Just a more modernization, but it's just the convenience.
Yeah. And it's real, the people that I know that have been using them are really happy about it. Heather herself has a background in with Medicare insurances because she's been an agent. She has a master's degree, and she loves to work with the senior population. But one of the things in the senior population, and I think the population across the board has been experiencing, is that doctors are moving around medical groups.
And it's so hard when you have a doctor that you really love and has been there every step of the circumstance in your life events, or really educates you and makes you feel comfortable is a huge importance to any patient. And when they move from medical group to medical group or open their own practice and go independent, it can be scary.
It's very scary. Also, what happens if you all of a sudden you move? This last year, I've picked up new clients who have moved to this area in Southern California. And I also have had clients that have moved to the other parts of the United States. Okay. So how do you go about choosing the right doctor for you, the right primary care doctor for you?
So sometimes it's just word of mouth, asking neighbors personally, but also you have great resources online. Really think about the area that you're living in. How far do you want to travel to see your doctor? And the number one thing is to make sure that they're contracted with your insurance. A lot of times your insurance is your first tool, because you can call them up on the customer service line and say, I just moved to this area. What plan do I need a plan transfer to make sure I'm in the right county? And is there a primary care physician accepting new patients? But really review them online. There's all this social media now that people are commenting on doctors. Really read about that. And also check the dates. See how the reviews, how recent they are.
Yeah, one of the things when I've done checking reviews of doctors, it will tell me, I'm a family doctor, I'm an internist, I am a general practitioner. What does that mean? What does all that mean?
So there's 3 different categories, basically. Your family practice physician is one that's really seeing all age ranges. So right when we're having our babies to elderly. And then there's internal med. Internal med usually are taking on those most chronically ill individuals. They're most common in hospital settings, but they are really prepared for someone with COPD, congestive heart failure, AFib. They're just a little bit more exposed to all those different variables, especially diabetes and dementia.
Yeah.
And then geriatrics is really just specialized medicine for aging. So a lot of our physicians at Welcome Health went the extra mile in education just to focus on senior care. Our bodies change as we age. Are we absorbing the same medications? Blood draws, how frequently these should be done is different when we get older. Our immunity is different when we're older. Recovering from surgery is a lot different than it was. Even pain medication can change drastically over time. And our cognitive abilities do change. So there's a lot of things our doctors are looking at in all different avenues to make sure that you're happy and healthy at any stage of life. But you need to identify a doctor that's really going to meet your individual needs at that time.
Yeah. So when I'm looking at it, we talked about geriatrics. But one of the other things, when I go through and I'm looking up doctors, and I do a lot of that for my clientele, okay, I'm looking up and I'm seeing, well, this doctor's an MD. This doctor's a DO. What is that? I mean, what is the difference?
No, it's really about making sure that, one, you have access to your doctor regularly. Are you happy speaking with the staff at that clinic? Are you able to get appointments regularly? Those are more essential for you, and that they're listening to what your needs are as a patient. Are they just looking at a computer screen, just checking off, or are they actually listening to you? Are they asking for your input, or are they delegating your care? There's a lot of times where patients feel that my doctor's ordering all of a list of things, and I don't understand why, and I'm scared. I don't want anyone to feel that way. Be an advocate for yourself if you need to. Ask your doctor, what do you think is going on? Why are we going through all of these imaging or lab work? Is there something that I should be a little bit concerned about? Education at every step of life is most important.
It's different. And I can really use myself as an example right now. I remember I needed a doctor. I went to one of my friends. She goes, oh, my doctor, he's wonderful. He's wonderful. He used to be one of the Olympic doctors and the whole thing. So I went to him, and I never felt like he was really paying attention to me. Okay. And when I would ask him about something, I think I was talking about weight, and he would just say, go for a walk. Okay. And I'm a diabetic. I don't hide any of that. Okay. And well, that's not just going for a walk. Okay. I mean, a walk is real important.
Yes.
Okay. It's very healthy to go for a walk, but I needed more than that. Okay. Because I was capable of that time of walking 5 and 6 miles a day. And he was telling me, increase it. And then after a while, I went, no, this isn't working for me. And then later on, like the same person that referred me to him, he couldn't even diagnose a case of shingles. And so she left him. Okay. And now I see he doesn't even have a practice anymore. So go with your instincts. It's really important that you follow your instincts. If you've been with a doctor for years and years and years, and you're finding out they're not meeting your needs again, maybe it's time to move.
I totally agree with you. There's a lot of times I'm talking to seniors and I say, when was the last time you saw your doctor? Well, it's been 3 years ago. I see the nurse practitioner. I see the PA. Or when was the last time you actually saw your primary care physician? And they couldn't even tell me sometimes. And then they start talking about it like, I actually haven't seen the same person every time I go to the clinic. It's really a good idea to go to the same person because they have their notes where they're really documenting and seeing a trend with you. Continuum of care is a real thing. So that's why it's really important to be consistent on who you're going with so they can see trends with you. One thing about Welcome Health that you're in your home setting, you're going to be more relaxed. You're less likely to be misdiagnosed with high blood pressure. Because sometimes if you're at the doctor's office and I just went to urgent care a few weeks ago, I can easily say my blood pressure was up because I was even nervous for myself going to the doctor. You get a little uncomfortable when you're sitting in a lobby and you're just waiting because you want to make sure that you're happy and healthy to be better for yourself and for other people around you. So you really have to consider that you need to be confident with your doctor. You're disclosing the most private information. Is your doctor actually addressing depression? Are they having that conversation with you openly? A lot of times seniors are really afraid to even mention that, and our doctors really address that as well.
Right.
Aging, there's a lot of things that go on. Some great milestones happen, but unfortunately there's a lot of loss too.
Right.
So it's good to have an open conversation with your doctor so that you're on the correct medications. Is there any goals in life that you want to do? Is it just walking down the aisle for a wedding and you know that you're stumbling a little bit? Is there something we can improve on that? Is there some exercises in your home at no cost that we can help educate you? And that's one thing I would really like to highlight is to keep moving, even no matter your age, whatever you're able to do. Everyone's level is different. So you said walking. For some people,
Okay.
that's a lot,
Right.
or for some, you get a little bored. You need
Right.
Zumba, you
Well,
need socialization.
yeah. One of the things, and it just clicked with me as you were talking, is that there may be things that the doctor that you've been seeing for years and years, say he's a family practice doctor, is not as familiar with as a geriatrics doctor, okay? And maybe you have a symptom that they're just not familiar with dealing with, where a geriatrics doctor, I think it's a terrible name, but that's okay. A geriatric doctor knows if you're complaining that your legs are bothering you, or you have aches and pains in your arms, those aches and pains for them are an everyday with that family doctor or that general practitioner. And even the internist may not have the experience of picking up.
And sometimes it's a counteraction of medications. So geriatricians really do focus in on evaluating all your medications, also including your over-the-counter medications. Is your cold medicine counteracting? Is the minerals or vitamins that you're taking too much or too less?
Yeah.
They're evaluating all of that.
Yeah. Because some of the your organs are not the same as when you were 40 years old or when you were 50 years old, because I had some supplementals that were taking away from potassium that was in my body.
Oh.
Okay. So when they redid all my medications, because I changed medical groups, okay, and when I went to with a certain doctor, he said, I want to take you off all your medications except your diabetes medication, and let's rebuild what's going on. And there was something in those combinations that was depleting potassium from my body.
Because everyone's different when it comes to
everyone's different, but as we age, it's not the same. And just like electronics are constantly changing, medicine is also changing. Okay. They're finding out new things. And I know I'm one that believes a supplement is always better than that medicine. But now I've come to the point where I realize that maybe that medicine is really good for me.
And it's also your diet as well. A lot of doctors need to address that with you. Supplements is not always the option for a lot of individuals. Right. So just having a consultation with your doctor on the correct diet for you, especially if you have high cholesterol or diabetes. How does carbohydrates actually affect diabetes? Having that basic education can empower you to do better for yourself, and you're going to feel better from it.
Yeah. And we're talking carbohydrates. We're talking about something that I love, that spaghetti, those breads. Okay. We're not just talking the sweets that they have the sugar in it. Those carbohydrates are even those dairy products. I mean, so when you're having those cornflakes with the raisins in it with your milk, if you're diabetic, it's going to spike it.
And you can have that conversation with your family because you can help improve their diet as well and do it together.
Right. So it's real important. If you're really computer literate, go online, do the research, read what they have to say about the different doctors and what their experiences are. Some of it may be the doctor's great, but I don't like waiting 2 hours in the waiting room.
That's really important. Please read some of those reviews and even ask the office, does this doctor, and you can, if you're in person, you can see their face, say, are they tended to be late? Are they on time with appointments? Because it's important to me. As we it's a lot for some people just to park, walk into an appointment, navigate a clinic, and get into the room. And it can be very stressful. So you want to be respected on your time too. And you want to have as much time with your doctor and not feel rushed.
Okay, so I have a question to ask. So when Welcome Health comes out, do they spend 15 minutes with the patient? Do they spend an hour or more?
It depends on the patient's needs. Especially our first appointment is about an hour to really get to know you.
Yeah.
And the best thing is the registration is done before our doctors come to the home. So we're able to reach out to your current primary care physician. If you have been in a hospital, skilled nursing in the last few years, so they have an idea of a clinical picture of you before they even come into the home. And then it's really just about listening. What's going on in your daily activity throughout the day? Let me look at some fall risk prevention in your home. Let's look at your medicine cabinet. Do we have expired medication? Is there anything over the counter that could be conflicting with your prescribed medication? There's so many things that could be done in the safety of your own home that you can't do in a clinic. And it's also, you're more likely to be more open and honest about what's going on.
Okay, well, thank you for that. We have to take a quick break and we're going to hear a word from our sponsor, and we will be back in a few seconds. Bye. This is WGSN-DB going solo.
At Benefits for You 2 Insurance Services, we believe knowledge is power when it comes to selecting the correct healthcare and Medicare insurance. Please contact us at healthcareoptions@benefitsforyou2.com or call us at 310-245-0332.
Welcome back to WGSN-DB Going Solo Network, and this is a Senior Citizens Forum. And I'm here with Heather Reid from Welcome Health, who takes an old-fashioned idea, modernizes it, and as she said earlier in our program, instead of coming with a little bag of stuff, they come with a backpack of stuff. I like that. And they brought it up to date, and you also know they're coming with their computer to put information in.
Yep, we're modernizing it.
Yeah, so everything is really organized instead of like having a file all over with stuff all over the place.
And it's really great when you're calling in on after hours or on a holiday, and we're able to bring up your information. So if a doctor's covering at that time, they're able to see everything for you. One thing that we were really discussing that I really wanted to really highlight is the importance of having a strong primary care physician and what that means.
Yeah.
A primary care physician really is overseeing all of your care. They want to make sure your medications are not counteracting, that your goals are actually being met with all of these specialists, but they want to make sure that you actually have a need to go to a specialist. There's a term that is used in the HMO world of it, that primary care physician is your gatekeeper. They're the ones really evaluating if you need to go see a cardiologist. They're the ones really evaluating if you need to have an MRI, CT, CAT scan, so that you're not unnecessarily referring yourself all over the place and stressing yourself out and being misdiagnosing yourself. So please do not do anything just searching on Google for symptoms.
A doctor
Talk
Google.
to your primary care physician about your symptoms.
Right. I refer that to as Dr. Google.
Yes.
Yeah.
Dr. Google can really go down the rabbit hole for a lot of people.
Right. But there's a lot of different search engines that you can look at that have more accurate information than others.
Yeah, I'm a really good source.
Yeah, there are some good sources out there, but unless you actually see a doctor, Dr. Google does not know you personally, or they've seen your blood test. So when going into that, if you do need to see a doctor online on an emergency, okay, your medical group, which we're going to talk about medical groups in a couple of seconds, lots of times we'll have doctors on call where you can call them. A lot of the different Medicare insurance products, even pre-Medicare insurance products now have doctors and or nurses that are available to you that you can contact on a 24-hour, 7 days a week basis, specifically like big holidays and stuff where maybe the doctors aren't on call. But that's real important. One of the things that's real important is that with your primary care doctor, they're the ones who decide if you do need to see a specialist. So if you have diabetes, maybe you need to go to an endocrinologist.
And it's just about making sure that you're getting educated and on the right medication for you. Majority of the time, a primary care physician, if you are diabetic,
Right.
especially internal med, and a geriatric physician, depending on your age, would be appropriate to help manage your diabetes. It's those that are really having a hard time managing those diabetes because they have a lot of comorbidities on top of that, they can refer to a specialist. But most primary care physicians, especially at Welcome Health, will be able to help manage your diabetes.
Right. But there's so many things that can go wrong with the human body.
Because not everyone is exactly the same.
And not everyone, it doesn't matter if you are an infant or you're 100 years old, things are going to go wrong with your body. And because I have a little niece that has leukemia, and she was diagnosed in 4.5. So it's like things go wrong. If you watched any of my other shows, I talk about her. Okay. So it's like you really need to know what's going on. And as we age, sorry to say, more things happen to the body and we don't understand. And sometimes it can be like those medications. So if you are going to a primary care doctor, they should have a list of all your medications. Because I know every time I walk into a doctor's office, have there been any changes in your medications since we've last seen you? Real important questions. And now they're asking, what supplements are you taking?
And I will be the first to say, I caught a doctor in urgent care for me, just said, is there any change in your medications? And I was like, can we verify what you have on your computer screen to make sure that it's accurate with my primary care doctor, because it was a different medical group and their records were incorrect. So I'm glad I didn't just say yes, all my medications are the same, because that was different 3 or 4 years ago compared to what it is now. And it could be drastic for someone that is much older. And there's been some times where high blood pressure medications, you've tried a few different things and have streamlined what you can take. So it's important that you are consistent in knowing what your medications are at every counteraction with any physician. So they make sure that they know what's going on with you.
I know right now a lot of seniors are computer literate. And for those that are, and they have the smartphone, your health insurance group and a lot of them, I'm not going to say all, a lot of the medical groups have apps online. And you go into those apps and it will list what your current medications are.
If you are tech savvy with those apps, it's a great resource for you, but there's always a good practice and old school mentality of writing down all your medications and keeping it in your wallet.
Right. So that's a good way to go, because I know I live with my app, but
you never know when you don't have service, right when you need it.
That's so true. I would be so lost if there was no service. Okay.
I mean, it happens to the best of us. Right when you need it is when it doesn't work for some reason, but it's always a good practice to have it written down just in case, but always reflect back to those portals that you have with your medical group.
That's just like when you go to travel, you should always have copies of your passport and everything with you. So it's a good idea in case you're in an area, and I know you probably were in an area recently because she just traveled to Africa, that she didn't have service. But you don't know, even when you're traveling, you don't know if you're going to need medical help. Okay, but we're going to go back to talking about choosing a doctor. Okay, so in the area that we're in, and it may not be throughout the whole United States, but in our area, we're used to medical groups.
Yes. Orange County, LA County, it's very concentrated in medical groups. And it's essential to identify what group your doctor is with, if they are with one, so that if you have an HMO, you know how to navigate, or if you have a PPO, that you're aware of different doctors being in different medical groups.
Right, because so many people believe that because they have a PPO, they can go anywhere. I think that was true several years back, but because of the medical groups and the insurance companies, the way they contract, not all doctors have contracts with medical groups. So you really need to know what is in your network and what's outside of your network. And be real careful, because I've gone online, I have checked for people, will find that they're even online, which is supposed to be the latest and the most recent information, is still wrong. They go to the doctor's office and they'll say, we don't take this PPO. I don't seem to have that problem that much with my HMOs, but I know from last year experience that all of a sudden I've had people calling me and saying, my medical group no longer takes my insurance.
And that's one thing to point out, is that your doctor office should ask for your medical information, health insurance information before you arrive, to prevent you showing up and realizing you're not able to be seen. One, that's wasting your time, especially if you paid for parking to get there, and just overall customer service, to make sure that you're in network at all times. Know what your copay is going to be at that day. You don't want to have a surprise out of network bill. You don't want to be calling Janice and saying, Janice, I got a bill for out of network. And what is that? You always want to make sure that you're in network. You don't want any surprise bills. So it's essential. And that's one thing to really point out from a doctor's office, is that they verify before you arrive.
Right. You want to make sure, especially in January or during the annual election period, we want to make sure that if your doctors are still contracted with that health plan. And just real quick, there's a difference between a health plan and a medical group. A health plan is what your insurance is. The medical group is a group of doctors. So which is going to take me into, if I need a referral, okay, is it easier for me to get it from my doctor or make that phone call myself?
So it depends on how you want to manage your care. If you're going to be responsible for yourself and know every doctor that is out of network or different medical groups, because you know that they're not going to be working together, able to see each other's clinical information on you, it's going to take a little bit more of your responsibility to manage that care. There's not a case manager or someone helping remind you through your health plan with a PPO. If you're in an HMO, they keep you in a medical group. They have all of your clinical information, so that you're going to a specialist in network. They're able to share your clinical, your labs, your imaging quickly with each other. And it just overall is a great continuum of care. But it depends on what's going on with your needs, how you want to manage your care, and what you're able to afford when it comes to HMO and PPO.
And one of the things I want to bring up, because I hear this complaint all the time, it's taking me 6 weeks to 2 months to get into a doctor's appointment. I've heard this from my relatives that are on the other side of the country. I hear it here. I hear it all over. There is a shortage of doctors.
And when it comes down to specialists, they are a specialist for a reason. There's not that many of that particular topic.
Right.
And your area. So you have to be willing to know that there's going to be a little bit of a wait time. So if you have a PPO and you're just calling in and you think that you're going to get an appointment tomorrow, it may not happen. Sometimes it depends on your primary care physician, and that they're able to support your reason to be seen sooner because of a proper referral. Your doctors can be a real advocate in helping those that are really ill, need to seek treatment sooner. So sometimes leverage that. But if you have a primary or PPO, excuse me, yes, you can go to a specialist fairly quickly, but it doesn't mean you're going to be seen sooner than someone with an HMO.
Yeah. And this is a really good point, because again, I'm hearing this all the time. Well, with the PPO, I can go wherever I want and I can make that appointment. I have been finding that if I get a referral, I get an appointment quicker. And also your doctor, just like Heather said, depending upon what you're being referred for, you may get an appointment the next week, because you may need to be seeing a doctor next week for whatever, how important it is to see, for you to be in to see that doctor.
Yeah, so it's essential to really have that conversation with your primary care physician. If there is a lab or an image that has been brought up that supports really that referral to be expedited and to get you in sooner, they will do that.
I just had that experience where one of my specialists went ahead and ordered something that he knew I was going to need to see another specialist with. And when I got to that other specialist, that information was there. So, which was really awesome. Not all doctors are going to do that, but that was a good experience from specialist to specialist, not even primary care.
And also, I just want to highlight, how easy is it to just speak to a medical assistant if you have a question about your medication or just a medication refill? Right. So that's important, is your primary care physician refilling your prescriptions timely? Are you having any challenges at the pharmacy when the doctor submits it? So little things like that is a great customer service, and it's just about patient care as a whole.
And the other thing that I have been finding is that if you do need that referral, okay, lots of times it's the doctor's office that's not passing it on to the insurance company or going through whatever their protocol is to do that referral. So if you find that your primary care doctor isn't doing that anymore, maybe it's time to be looking for a new primary care doctor. But if they are, and your doctor is listening to you and you feel comfortable, but if there's something going on inside you, that inner instinct that says it's time to look for somebody new, follow your instincts, because there is help out there for you to do that. And even insurance agents will help you find a new primary care doctor.
And I think it's really important to think that you have to think about yourself, your health plan, your primary care physician, your medical group if you need one,
right,
your hospitals, that it all depends on what your needs are and not what your neighbors' needs are.
Right.
I hear this too many times when I'm out in the community, especially at senior apartments, because they love each other so much and are out and about, and they just talk about their health plans, how great my benefit is to someone else. Your neighbor's benefit may be best for them and not for you. So right. Don't automatically think, my neighbor has this, I need to be on this plan. But that may mean that you're not seeing the same doctor. It may not mean that your formulary is covered for your medication. So please think about yourself first. Identify an HMO PPO for you that's best for you, and talking to a licensed agent like Janice, especially with Medicare, that's hard to navigate. But it's essential to be on the right plan, the right doctor that listens to you, and the right medical group. It's a whole formulary in its own, individualized by, and some couples may not have the same doctor. They may not be the same medical group. They may not even have the same HMO or PPO, because we all have different medical needs.
Absolutely. That is one of the most important things. We're all unique, so our needs are going to be unique. And your doctors may have been great for you 10 years ago, but that doctor may not be great for you anymore. And it's sad to leave a doctor that you've seen for so long.
Oh, I totally agree.
Yeah, it's very hard.
I remember my primary care doctor to quite a few of my friends, and I can't imagine leaving her, but there may be a time when it truly is appropriate that I have to really.
It's truly appropriate, because your life is the one that's at stake. So you need to make that decision. Well, one of the things I want to talk a little bit more about medical groups, and then one of the other questions I get, well, does my doctor go to which hospitals? which is all real important. So if a certain hospital is important for you to go to, how does all that work along with the medical groups?
So that's one thing you have to think about for yourself. There are some doctors that go to hospital settings, skilled nursing, and clinic. There's some primary care doctors that are only in the clinic. There's some like Welcome Health that are mobile. So there's all different types of physicians out there. You have to identify what's best for you. You need to ask, really, and what is important to you. But in a medical group, there is hospitals that they're contracted with and that they are their preferred hospitals. And that's where you would have your planned surgeries. But it also depends on your specialist. Where do they have privileges at those hospitals? So it really comes down to that intimate conversation about what your needs are, what's important to you. Sometimes it's hospital first, then doctor, then medical group, or vice versa. Everyone has a different formula when it comes to what is essential. It depends on what county you're in, the medical groups that are offered for you, and the health plans that are offered for you, and their benefits. It really is so different just from me in Orange County and you in LA County, and the benefits for some of the health plans. The benefits are a little bit different, or the co-pays, and it could be one person in LA with like one thing, plan A, and
Right.
they want plan B because of Orange County. It
Right.
all
We're
comes down
talking
to that.
supplemental plans now. Yeah.
So, or HMO or PPO.
Well, yeah.
But it's just really identifying and listening to yourself and your needs. And
Yeah.
even talking, if you're moving, like we started at the very beginning, if you're new to the area, even just going to your local senior center,
Mhm.
and asking, when are you having a resource fair, or who comes in here regularly? Do you have anyone that you recommend that I speak to that can help navigate me? Some local senior centers have a free case manager. They can sit down and listen to your needs and then give you some suggestions. It's all about patient choice, and that is the most essential thing.
Right. And one of the most important things, and I just said it a couple of minutes ago, every individual is unique. All of our needs are unique. So if you're talking to 5 or 6 people who have similar things to you, you're still unique. So make sure you look at what is correct for you. I just have a client that has just moved to a different state, and she called me up and saying, I don't like what I selected. What do I need to do? I told her what she needed to do. I wasn't the agent to help her because I'm not licensed in that state, but we moved on to someone else that could help her. I found her someone that could help her out. So it's real important you know what your needs are, and go online if you're computer illiterate. Do your research. Not only look at what's right about the doctor, look about if there's anything negative and find out what those negative things are being said too. And if it's just the fact that they sat in the waiting room too long, well, I would question that, because not everybody's experience is going to be the same experience.
And just keep in mind, there are some comments that are out there that may not actually be about the doctor. So just really read and think about what's important to you first. Some people may have just posted something inappropriate. So I just want to highlight that. Same thing when you're on Yelp, on other service lines. So take it with a grain of salt, but just educate yourself, look at different review sites, but really going in person to the clinic. If you are going to a clinic in person, just make sure that you're comfortable, because the last thing you want to do is when you're not feeling good is, who's my doctor? What are my prescriptions? You want to feel confident and going, okay, I'm not feeling good. I know who to call. I know how to take care of myself, or to tell your significant other or caregiver how to help you.
Right. So that's real important. This is really good information for today.
Janice,
thank you so much for
so
coming.
knowledgeable for everybody. They're so fortunate to have you.
Thank you.
And just sharing your knowledge and connections that you have.
Yeah.
So we're very appreciative of you.
Thank you. Excuse me. I've been talking a lot this week.
It's busy season.
It's a busy season right now. Yes. So any information, if you have you require more information, you can go online and type it into us. You can find us on Roku, you can find us on YouTube, you can find us on Facebook, different sources you can find us at. If you want to talk to me or to Heather, our information is going to be posted in here. We would love to hear from you if you're watching this show, and we would love to have your feedback. Thank you very much for watching. This is WGSN-DB Going Solo, a Senior Citizens Forum. Thank you for watching and have a great day.